remember, he was operating through a middleman. Every GP visit would have cost him money. That's why 4 years after his operation, he's in bad shape. So this is where you live?
This is like my everything, my bedroom, my sitting room, my, kitchen, everything is this.
This place is horrible.
It is.
And are you must be freezing here at night, are you?
You can imagine.
Now he's desperate to go home to India. He claims he asked the Home Office to deport him, but he says they refused. Back in Southall, our undercover reporter has met up with the middleman to check whether my alias, the Kosovan builder Dardan Luma, has got his doctor's appointment. To make sure it's done, the middleman is introducing us to his accomplice, one step up the chain, Shaman Lal.
Dardan, jida garden hunda?
Dardan Lama. Dardan Lama. ਲੋ ਜੀ ਹੁਣ ਕੱਲ ਕੰਮ ਹੋ ਗਿਆ ਗੱਲ ਤੇ ਕੱਲ ਵੀ ਕਰ ਸਕਦੀ ਹੈ ਕੰਮ ਤੁਹਾਡਾ ਕੋਈ
Shaman Lal has promised our man will be an NHS patient soon. So far, we've uncovered a world of middlemen and fixers who have paved the way into GP surgeries from the outside. Then, we heard about an NHS insider working within the system. He's a practice manager here in Birmingham, said to be arranging access for health tourists to doctors. Our undercover man, Raj, has already been to see him. You've made a contact?
Yes. I made a contact with a man called Asif Butt.
And it appears he's willing to do business.
And I let it be known to him, my cover, which is that I'm a travel agent, tour operator based here, who is taking care of wealthy clients from India.
But our undercover man isn't working alone. Meet our next undercover operative. She's an English journalist, but that's not what she'll be telling the NHS practice manager.
Okay. And your name is going to be Preeti Taggar.
Preeti Taggar.
Preeti Taggar, yeah?
Raj's cover story is that Preeti is his niece. He'll say she's just arrived from India and is not entitled to NHS care. A health tourist. Asif Butt greets us outside the large Sparkbrook Health Centre in Birmingham, where he's one of the practice managers. He ushers our man Raj into a doctor's private room. Asif had already offered to register Preeti at the centre without the ID they normally request. We wanted to know how he was progressing.
She's gone through the process.
How long will it take?
It takes 5 to 6 weeks.
Right, okay.
But if there's an emergency, then she can come in.
Right.
Our undercover reporter has already discussed that he may have tourists from his travel agency who are interested. Asif is keen.
Tourist online September any interest express some of them they're coming as tourists.
I can do all of them.
Asif then hands us the registration forms for our potential health tourists. 14 of them. It looks like open house on the NHS.
But you're happy to do 10? I mean, if I can reduce it...
12, 13, 14 pounds.
You're happy to do 10? You're happy with 10?
There's 4 extra.
Okay.
If everybody else comes, you keep them. If you make a mistake, just shoot.
Yeah.
It seems it couldn't be simpler. Our fictitious health tourists don't even need to show up. All we have to do is fill in the forms and they're in.
What do we put about visas and things like that?
But there's nothing about visas.
Okay. All right.
Because I've made the forms. There's another form there. If there's one here. It's a purple foam.
Yeah.
So I have done this myself.
Okay.
And I've took out the...
All right. The visa bit. Yeah.
Asif tells us that he's not processed a big group of health tourists like this before, but he has done them, one at a time.
Thank you, sir. So, there's no problem with tourists coming here. You've done that before with your tourists. With your tourists.
Yeah, you patient registered.
Yeah.
The mother comes and, I do it.
As if she comes as a tourist. Okay,
Yeah.
all right. But this is all right. You're okay with this? All right.
This is between you and me.
Yeah.
The more people find out...
No. Just yeah.
Having sworn us to secrecy, Asif says he'll be in touch soon. Until recently, there was huge confusion in the system as to whether health tourists and illegal immigrants had the right to register on an NHS list. Some GPs did, many didn't. But in July of this year, an NHS body issued a clarification of the guidance. Doctors are now told overseas visitors, whether lawfully in the UK or not, are eligible to register with a GP. The guidance adds that GPs should not turn down patients because they fail to provide proof of ID or address. In effect, GPs are advised they should now take all comers. It follows a number of successful legal challenges to GPs who have refused primary care to illegal immigrants. Adam Hunt is one of the lawyers leading these challenges.
A particularly memorable case that I dealt with was a young and vulnerable teenage mother. She had a young baby. She'd been a victim of sex trafficking, and the baby was a result of enforced prostitution. And before she came to me for help, she'd spent 9-12 months looking for a GP and being turned away and turned away and turned away.
How many cases have you taken against GPs who've refused to register people?
I suppose probably about 30 or 40 over the last 2 or 3 years.
And have you ever lost?
No one's fought any of them. I suspect because as soon as they take legal advice, they know that we're right.
But not everyone agrees. Dr. Chris Clayton-Payne has a practice in rural Saffron Walden. He says his surgery still sees 8 to 10 overseas visitors a week.
The guidance changed radically in July of this year when we received an email from the NHS Primary Care Commissioning Organisation, and quite clearly states who is and who is not entitled to National Health Service care in the UK as an overseas visitor. That is basically everybody is now entitled to...
Everybody?
Everybody. We are not allowed to make any discrimination.
What's your reaction to that?
It seems very strange when we're shaving off the pennies here and there to actually open the door wide open to the citizens of the world to walk in and have free medical care at primary care level in the UK.
I went to ask the Health Minister at her constituency office about the change in guidance. If doctors are now obliged to register everyone, though, isn't it the case that the system is therefore open to abuse?
We know there are abuses, but we know that some GP practices put quite strict rules and regulations in place before they will accept somebody on their books. And we know that we've got to tighten up the system. That's why we're having the review.
But the government review into how the NHS deals with overseas visitors won't be out until next year. For the time being, many GPs seem unaware of the new guidance. Each of the surgeries where our undercover operatives are buying black market access officially still has a policy of not registering health tourists or demanding ID. Meanwhile, the black market prospers. In West London, Chamanlal meets us again to let us know how the registration of the Kosovan immigrant Dardan Luma is going.
ਜਿਹੜਾ ਉਹ ਡਾਰਡਨ ਲੂਮਾ ਆ ਉਹਦਾ ਹੁਣ ਅਪਾਇੰਟਮੈਂਟ ਬਣ ਗਈ
ਨਹੀਂ ਮੈਂ ਅੱਜ ਬਿਜੀ ਰਿਹਾ ਹਾਂ ਸਵੇਰੇ ਤੁਹਾਨੂੰ ਬਣਾ ਕੇ ਦੱਸ ਦੂੰਗਾ ਹਾਂ ਉਹਨੇ ਕੀ ਕੀਤਾ ਨਹੀਂ ਮੈਂ ਇਹ ਕਹਿੰਦਾ ਵੀ ਉਹ ਰਜਿਸਟਰ ਹੋ ਗਿਆ ਹੁਣ ਜੀ ਹਾਂ ਪੱਕਾ ਹੁਣ ਸਾਡੇ ਕੋਲ ਹੋਰ ਵੀ ਹੈ ਨਾ ਬੰਦੇ ਹੈਗੇ ਆ
Chamanlal seems happy to do this for illegal immigrants like Dardan, but that's not all.
ਜਿਹੜੇ ਹੁਣ ਕਿਸੇ ਦੀ ਫੈਮਿਲੀ ਮੈਂਬਰ ਆਇਆ ਮਿਲਣ ਉਹ ਵੀ ਹੋ ਸਕਦਾ
ਹੁਣ ਜੇ ਨਾ ਕੋਈ ਸਾਡੇ ਰਿਸ਼ਤੇਦਾਰ ਆਏ ਉਹਨੂੰ ਡਾਕਟਰ ਦੀ ਲੋੜ ਆ ਤਾਂ ਬਣਵਾਉਂਦੇ ਆ ਤੁਸੀਂ
Chamanlal is confident that he's selling access not just to a GP, but to the whole NHS.
So a full national health service होगी हाँ free
free होंगी
ये डॉक्टर भी पैसे खांदा था तो
ये तो पानी भी इतना होंगी है
हाँ
Darden Lume is registered with a doctor, and by selling a place on a GP's list, Chamanlal may be committing fraud. And the doctor's appointment has come through. So I'm handing over the Darden Lume identity to an Eastern European, Alex, who's really from the region. Hi.
Hi.
Alex will be better placed to answer any questions that might come up about Darden Lume's background.
We'll see how far we can get, and I'll meet you afterwards and see what happens.
Definitely.
All right, good luck with it.
Thank you.
Back in Birmingham, our undercover operative is meeting Asif Butt, the NHS practice manager. He wants to talk money. Raj's fictitious niece is registered with a doctor, and Asif has offered to help a group of Indian tourists get registered so they can come here for medical treatment.
Was it in India?
Yeah, I've got 5 ready. 5 is ready. These are the ones who said we are interested. Go ahead. 1, 2, 3, 4. That's 5. And the other 5 are saying, what is the figure?
Asif's services don't come cheap. Even registering Raj's fictitious niece Preti will be expensive. Asif says there are 4 mystery men further along the chain, all of whom need to be paid off.
I don't know, £200 each?
£200 each.
I think that's if they agree to it, them or not. Because don't forget, they're not stupid. They know, you know.
All right, I'll do Preti first then. I will do that.
Is it okay?
Yeah.
Give me 250. Listen to me.
Yeah.
I will negotiate with them. If they do 2-2, then I'll give them 250.
Okay, that's
But if it's not, I'll give back to you.
1, 2, 3, 4.
Raj is now apparently paying off Mr. Butt and 4 other people.
200, 260.
Then 250 for each person.
For each person?
Yeah.
So how much is that?
There's 4 of them, isn't it?
The cost is rising fast.
So how much is that in total?
Well, it'll be 800 a month.
800? That's a bit much.
We only have £500 on us, so we promise to come back with the rest. Asif tells us we're getting a bargain.
But you see, if you went private, first you have to pay the GP. I think it's about £60 for first consultation, and then it's £40 for every half hour. Then you have to pay for the treatment in the hospital. You have to pay for all the tests.
Yeah.
Yeah, and then you have to pay for the medicines.
Yeah.
And if somebody comes with a, for example, if they got cancer, that's £500 injection.
Each injection?
Each injection, £500.
£500?
£500, and they need an injection every month.
Yeah.
So, based on that,
it's value, yeah. So what you're saying is that this is good value?
Finally, Asif makes an appointment for Preti with a doctor for the following week. By selling access to the GP's list, he may be committing fraud. There's no suggestion that anyone else at the clinic was involved in this or received any money from Asif Butt. By now, each of our undercover patients, through the fixer, the middleman and practice manager, has been registered with a GP and has an NHS number to show for it. The next step will be to introduce them to hospitals. But the rules are different when it comes to secondary care, to hospital care. Then only people who are ordinarily resident in the UK, who have been here for more than a year, are entitled to free care. Virtually everybody else should pay. But we've been hearing problems with how hospital checks work in practice. We've been told that being registered with a GP means many overseas visitors are accepted into the system, no questions asked.